From coast to coast and all points in between. This is the news so far. I am Vincent Moniz. Stuff and things are always changing. I've got a few to share, and then I'll dive face first into healthcare. Come on, let's take a cruise. President Trump renamed Denali, North America's tallest mountain, back to Mount McKinley. This change reverses the 2015 decision by President Obama to officially recognize the mountain's traditional name, Denali, meaning high one or great one in Athabascan. For Alaska Natives, Denali holds deep cultural and spiritual significance. In 1975, the state of Alaska petitioned to rename Mount McKinley to Denali, recognizing the mountain's importance to indigenous people. Trump's executive order claims to honor President McKinley's legacy, but it disregards the cultural significance to Denali to Alaska Natives. Ironically, the order also instructs the Secretary of the Interior to work with Alaska Native entities to adopt names for landmarks that honor their history and culture. President Trump's administration continues to make waves with its decisions on indigenous issues, stumbling from Alaska all the way to South Dakota. A tribal nation in the state has lifted its ban on Governor Kristi Noem, just days before her hearing to join Trump's cabinet. The Flandreau Santee Sioux had banned Noem from entering their land after she made comments suggesting tribal leaders were catering to drug cartels on their reservations. However, in a recent statement, the nation announced they are now dissolving the ban, citing an apology from Noem for the misunderstanding. The statement also expressed support for her nomination as Secretary of the Department of Homeland Security. It's worth noting that Governor Noem was initially banned by multiple tribes in the state, but it's unclear if the other tribes will follow Flandreau Santee's lead. The nomination hearing is set to take place this Friday, while she'll face the Senate Committee on Homeland Security and Governmental Affairs. We're going to stay in South Dakota, where a different kind of crisis continues: the struggle for adequate health care for Native people. Indigenous communities in the state face limited access to health care. In rural and reservation areas, people must drive over an hour for basic care like giving birth or cancer screenings. The numbers are concerning. Native Americans in South Dakota are over 4 times more likely to die in infancy and face higher mortality rates from diseases like diabetes and cervical cancer. A severe shortage of healthcare workers is the main issue. While programs like the Rural Healthcare Facility Recruitment Assistance Program aim to recruit doctors and nurses, it's an ongoing challenge. Many reservation clinics have limited hours, and emergency care often requires a 911 call and a wait for an ambulance. The state's new Wellness on Wheels program provides mobile healthcare services, but more work is needed to address the deep-seated health disparities in Native communities all over Indian country. The struggles of Native communities in accessing healthcare, well, they're compounded by another alarming issue: medical debt. A new report by Investigative West reveals a shocking truth. Natives face double the average medical debt, often for bills that aren't even their responsibility. The investigation, focused on Washington state, found that nearly 1 in 5 natives struggle with medical debt, which can lead to financial ruin and impossible choices between paying bills or putting food on the table. Billing errors, insurance mix-ups, and confusing paperwork are just some of the factors contributing to this crisis. The Indian Health Service's limited funding and bureaucratic red tape, well, that only makes things worse. It's a crisis that demands attention and action. As the investigation sheds light on the severe rate of medical debt among Native Americans in Washington state, it also highlights the urgent need for reform and accountability. The Indian Health Service is supposed to provide health care for Indigenous Americans, but the U.S. government often fails to pay medical bills, leaving patients to deal with debt collectors. When Native patients need specialized care, they're sent to non-IHS providers. However, the IHS frequently doesn't cover these costs despite being responsible for doing so. A January 2023 report by the U.S. Department of Health and Human Services Office of Inspector General revealed that patients are being sent to collections for unpaid bills. In some cases, These debts are even being sold to collection agencies, causing financial hardship and stress for already vulnerable patients. This highlights a complex challenge in ensuring Native patients receive necessary medical care while resolving payment responsibilities. A more detailed look is needed to address this concern. While the U.S. government seems to be dropping the ball when it comes to Indigenous people receiving necessary medical care, one state is shaking things up. Oregon has taken steps towards culturally sensitive healthcare. As of January 1st, 2025, Medicaid and the Children's Health Insurance Program now cover traditional Native healing practices. This means individuals can use their benefits to pay for ceremonies, herbal remedies, and healing ceremonies led by spiritual leaders. Governor Tina Kotek and the state's health authority worked closely with tribal leaders and healthcare experts to make this change happen. This development is a major victory for Native communities who have fought long for healthcare that respects their traditions and culture. That's all I have for now. Thanks for listening to the news so far. Join me next time for stories from the down, brown, and greasiest parts of Orion's arm. This program is produced by me, recording myself underneath a buffalo robe in my living room. The theme does not exist, because I'm afraid the entire Wu-Tang Clan will bring the ruckus on me if I use their music. I am Vincent Moniz. Until next time, stay informed and engaged. We're all we got.